Hi, everyone. This is Nurse Anna from nursestudy.net. Here we have 75 questions for neurological disorders with answers and rationales. If you want to see a disease process or you want test questions on any other subject, please leave it in the comments down below. Enjoy.
Would you like free audiobooks? Click the link in the description. Question 1. A 55-year-old male patient with a history of hypertension presents with a sudden onset of severe headache, nausea, vomiting, and neck stiffness. What is the most likely diagnosis? A. Tension headache. B. Subarachnoid hemorrhage. C. Migraine. D. Cluster headache. Answer: B. Subarachnoid hemorrhage. Rationale: a sudden severe headache, often described as the worst headache of my life, along with nausea, vomiting, and neck stiffness, is indicative of a subarachnoid hemorrhage, typically caused by a ruptured aneurysm. Question 2. A patient with multiple sclerosis, MS, is experiencing new-onset double vision and dizziness. Which initial assessment finding would be most concerning? A. Numbness in extremities. B. Unsteady gait. C. Difficulty speaking. D. Decreased level of consciousness. Answer: D. Decreased level of consciousness. Rationale: while all symptoms are concerning in MS, a decreased level of consciousness indicates a potential acute complication, such as brainstem involvement, and requires immediate attention. Question 3. A 40-year-old female presents with ptosis, diplopia, and muscle weakness that worsens with activity and improves with rest. Which diagnostic test is most appropriate to confirm the suspected diagnosis? A. MRI of the brain. B. Lumbar puncture. C. Electromyography, EMG. D. Tensilin test. Answer: D. Tensilin test. Rationale: the Tensilin test is used to diagnose Myasthenia gravis by temporarily improving muscle strength following administration of edrophonium chloride. Question 4. A patient with Parkinson's disease is experiencing increased rigidity and bradykinesia. Which medication adjustment would the nurse anticipate from the healthcare provider? A. Increase in carbidopa/levodopa dosage. B. Addition of a cholinesterase inhibitor. C. Initiation of antiepileptic drugs. D. Reduction of beta blocker dosage. Answer: A. Increase in carbidopa/levodopa dosage. Rationale: carbidopa/levodopa is the mainstay treatment for Parkinson's disease, and an increase in dosage can help manage worsening rigidity and bradykinesia. Question 5. During the assessment of a patient with Guillain-Barré syndrome, which finding would require immediate intervention? A. Ascending muscle weakness. B. Absent deep tendon reflexes. C. Difficulty breathing. D. Paresthesia in the toes. Answer: C. Difficulty breathing. Rationale: Guillain-Barré syndrome can lead to respiratory muscle paralysis, and difficulty breathing is a medical emergency requiring immediate intervention. Question 6. A 68-year-old male with a history of atrial fibrillation presents with sudden right-sided weakness and aphasia. What is the most likely cause? A. Hemorrhagic stroke. B. Ischemic stroke. C. Transient ischemic attack, TIA. D. Brain tumor. Answer: B. Ischemic stroke. Rationale: the sudden onset of right-sided weakness and aphasia in a patient with atrial fibrillation suggests an embolic ischemic stroke, commonly caused by a clot originating from the heart. Question 7. A nurse is caring for a patient with increased intracranial pressure, ICP. Which intervention should be included in the nursing care plan to decrease ICP? A. Keeping the patient in a supine position. B. Encouraging the patient to cough frequently. C. Maintaining head of bed at 30 degrees. D. Providing large volume IV fluid boluses. Answer: C. Maintaining head of bed at 30 degrees. Rationale: elevating the head of the bed to 30 degrees promotes venous drainage from the brain, helping to decrease ICP. Question 8. A patient with Alzheimer's disease is admitted for acute confusion and agitation. Which medication order should the nurse question? A. Donepezil. B. Haloperidol. C. Rivastigmine. D. Memantine. Answer: B. Haloperidol. Rationale: haloperidol, an antipsychotic, is often avoided in Alzheimer's patients due to the increased risk of worsening cognitive symptoms and potential for adverse effects. Question 9. A patient with amyotrophic lateral sclerosis, ALS, reports increasing difficulty swallowing. Which intervention is most appropriate to address this concern? A. Thicken liquids. B. Pureed diet. C. Nasogastric tube feeding. D. Parenteral nutrition. Answer: A. Thicken liquids. Rationale: thickened liquids are easier to swallow and reduce the risk of aspiration in patients with dysphagia due to ALS. Question 10. A patient with a history of epilepsy is admitted after experiencing a generalized tonic-clonic seizure. Which lab value is most important to review? A. Serum sodium. B. Serum calcium. C. Serum glucose. D. Serum potassium. Answer: C. Serum glucose. Rationale: hypoglycemia can trigger seizures, so reviewing serum glucose levels is crucial to identify and address potential underlying causes. Question 11. A 25-year-old female with a history of migraines presents with a severe headache, visual disturbances, and photophobia. Which medication would the nurse anticipate the healthcare provider to order first? A. Acetaminophen. B. Ibuprofen. C. Sumatriptan. D. Morphine. Answer: C. Sumatriptan. Rationale: sumatriptan is a first-line medication for acute migraine attacks due to its effectiveness in relieving headache and associated symptoms. Question 12. A patient with Huntington's disease is experiencing severe chorea. Which medication would the nurse expect to be prescribed to help manage this symptom? A. Levodopa. B. Tetrabenazine. C. Phenytoin. D. Clonazepam. Answer: B. Tetrabenazine. Rationale: tetrabenazine is specifically used to manage chorea in Huntington's disease by decreasing dopamine levels in the brain. Question 13. A patient with a history of chronic alcohol abuse presents with ataxia, confusion, and ophthalmoplegia. What is the most likely diagnosis? A. Wernicke's encephalopathy. B. Korsakoff syndrome. C. Subdural hematoma. D. Central pontine myelinolysis. Answer: A. Wernicke's encephalopathy. Rationale: Wernicke's encephalopathy, caused by thiamine deficiency, is characterized by ataxia, confusion, and ophthalmoplegia, commonly seen in chronic alcohol abusers. Question 14. A nurse is caring for a patient with myasthenia gravis who is experiencing a myasthenic crisis. Which intervention is a priority? A. Administering IV immunoglobulin. B. Plasmapheresis. C. Increasing anticholinesterase medication. D. Providing mechanical ventilation. Answer: D. Providing mechanical ventilation. Rationale: in a myasthenic crisis, respiratory failure is a primary concern, and ensuring adequate ventilation is the immediate priority. Question 15. A patient with a recent diagnosis of multiple sclerosis presents with urinary retention. Which intervention would be most appropriate? A. Scheduled intermittent catheterization. B. Continuous Foley catheter. C. Increase in oral fluid intake. D. Administration of diuretics. Answer: A. Scheduled intermittent catheterization. Rationale: intermittent catheterization helps manage urinary retention and reduce the risk of infection compared to continuous catheterization. Question 16. A nurse is assessing a patient with suspected bacterial meningitis. Which of the following findings would be most concerning? A. Headache and photophobia. B. Positive Koenig sign. C. Purpuric rash. D. Neck stiffness. Answer: C. Purpuric rash. Rationale: a purpuric rash may indicate meningococcemia, a life-threatening complication of bacterial meningitis, requiring immediate intervention. Question 17. A patient with a history of stroke presents with sudden loss of vision in one eye. What is the most likely cause? A. Retinal detachment. B. Central retinal artery occlusion. C. Optic neuritis. D. Glaucoma. Answer: B. Central retinal artery occlusion. Rationale: sudden, painless loss of vision in one eye is characteristic of central retinal artery occlusion, which can occur in patients with a history of stroke or other vascular diseases. Question 18. A patient with a spinal cord injury at T6 level presents with a pounding headache, flushed skin above the injury level, and bradycardia. What is the most likely cause? A. Autonomic dysreflexia. B. Spinal shock. C. Neurogenic shock. D. Hypovolemic shock. Answer: A. Autonomic dysreflexia. Rationale: autonomic dysreflexia is a life-threatening condition that occurs in spinal cord injuries above T6, characterized by severe hypertension, headache, and bradycardia. Question 19. A nurse is caring for a patient post-craniotomy for a brain tumor resection. Which assessment finding would be most concerning? A. Slight headache. B. Pupillary changes. C. Decreased appetite. D. Mild fever. Answer: B. Pupillary changes. Rationale: pupillary changes can indicate increased intracranial pressure or brain herniation, requiring immediate evaluation and intervention. Question 20. A patient with a suspected diagnosis of amyotrophic lateral sclerosis, ALS, presents with progressive muscle weakness and fasciculations. Which diagnostic test would be most appropriate? A. MRI of the brain. B. Electromyography, EMG. C. Lumbar puncture. D. CT scan. Answer: B. Electromyography, EMG. Rationale: EMG is used to diagnose ALS by assessing the electrical activity of muscles and identifying characteristic patterns of denervation and reinnervation. Question 21. A patient with Guillain-Barré syndrome is receiving intravenous immunoglobulin, IVIG, therapy. Which assessment finding would require immediate intervention? A. Fever and chills. B. Flushing and itching. C. Difficulty breathing. D. Muscle pain and weakness. Answer: C. Difficulty breathing. Rationale: difficulty breathing during IVIG therapy can indicate an anaphylactic reaction or progression of the syndrome to involve respiratory muscles, requiring immediate intervention. Question 22. A nurse is providing discharge teaching to a patient with a new diagnosis of Bell's palsy. Which statement indicates that the patient understands the teaching? A. I should avoid using facial expressions until my symptoms improve. B. I need to take my antiviral medication as prescribed. C. I will need surgery to correct this condition. D. This condition is caused by a bacterial infection. Answer: B. I need to take my antiviral medication as prescribed. Rationale: Bell's palsy is often treated with antiviral medications, as it is believed to be associated with viral infections such as herpes simplex. Question 23. A patient with a history of myasthenia gravis presents with severe muscle weakness and is diagnosed with myasthenic crisis. Which medication is most likely to be administered? A. Pyridostigmine. B. Atropine. C. Diazepam. D. Baclofen. Answer: A. Pyridostigmine. Rationale: pyridostigmine, an acetylcholinesterase inhibitor, is used to improve neuromuscular transmission and increase muscle strength in myasthenic crisis. Question 24. A patient with a history of epilepsy is prescribed phenytoin. Which patient teaching point is most important to emphasize? A. Avoiding dairy products. B. Taking the medication with meals. C. Maintaining good oral hygiene. D. Limiting fluid intake. Answer: C. Maintaining good oral hygiene. Rationale: phenytoin can cause gingival hyperplasia, so maintaining good oral hygiene is essential to prevent this side effect. Question 25. A patient with multiple sclerosis reports experiencing severe fatigue. Which intervention should the nurse prioritize? A. Encouraging regular exercise. B. Scheduling rest periods throughout the day. C. Increasing caffeine intake. D. Administering a stimulant medication. Answer: B. Scheduling rest periods throughout the day. Rationale: fatigue is a common symptom of multiple sclerosis, and scheduling rest periods helps manage energy levels and prevent exhaustion. Question 26. A patient with suspected meningitis undergoes a lumbar puncture. Which finding in the cerebrospinal fluid, CSF, would be most indicative of bacterial meningitis? A. Elevated protein levels. B. Decreased glucose levels. C. Presence of red blood cells. D. Clear appearance. Answer: B. Decreased glucose levels. Rationale: in bacterial meningitis, the glucose level in the CSF is typically decreased due to the consumption of glucose by bacteria. Question 27. A patient with Parkinson's disease is experiencing dysphagia. Which nursing intervention is most appropriate? A. Encouraging large meals. B. Offering thin liquids. C. Providing a speech therapy consultation. D. Administering an antiemetic. Answer: C. Providing a speech therapy consultation. Rationale: a speech therapist can assess and provide strategies to manage dysphagia, ensuring safe swallowing and reducing the risk of aspiration. Question 28. A patient with a recent diagnosis of ALS is experiencing difficulty speaking. Which intervention would be most helpful? A. Providing a communication board. B. Encouraging the patient to speak louder. C. Administering speech therapy. D. Offering written communication. Answer: A. Providing a communication board. Rationale: a communication board can help patients with ALS communicate effectively when they have difficulty speaking. Question 29. A nurse is caring for a patient post-stroke who is experiencing unilateral neglect. Which intervention should be included in the nursing care plan? A. Placing objects on the affected side. B. Encouraging the patient to ignore the affected side. C. Providing care on the unaffected side only. D. Using a sling on the affected arm. Answer: A. Placing objects on the affected side. Rationale: placing objects on the affected side encourages the patient to attend to that side, helping to reduce unilateral neglect. Question 30. A patient with myasthenia gravis is experiencing ptosis and muscle weakness. Which test is used to confirm the diagnosis? A. Electromyography, EMG. B. Lumbar puncture. C. MRI of the brain. D. Tensilin test. Answer: D. Tensilin test. Rationale: the Tensilin test, which uses edrophonium chloride, is used to diagnose myasthenia gravis by temporarily improving muscle strength. Question 31. A patient with a history of epilepsy is being discharged with a prescription for levetiracetam. Which instruction should the nurse include in the discharge teaching? A. Take the medication on an empty stomach. B. Avoid driving until you know how the medication affects you. C. Increase your intake of green leafy vegetables. D. Discontinue the medication if you experience dizziness. Answer: B. Avoid driving until you know how the medication affects you. Rationale: levetiracetam can cause dizziness and drowsiness, so patients should avoid driving until they know how the medication affects them. Question 32. A patient with a history of migraines is experiencing an aura followed by a severe headache. What is the first-line treatment to alleviate the headache? A. Acetaminophen. B. Sumatriptan. C. Propranolol. D. Amitriptyline. Answer: B. Sumatriptan. Rationale: sumatriptan is a first-line treatment for acute migraine attacks and is effective in alleviating headache and associated symptoms. Question 33. A patient with myasthenia gravis is scheduled for a thymectomy. What is the purpose of this surgical intervention? A. To remove a tumor. B. To improve muscle strength. C. To reduce the production of autoantibodies. D. To prevent respiratory complications. Answer: C. To reduce the production of autoantibodies. Rationale: thymectomy is performed in myasthenia gravis to reduce the production of autoantibodies that attack the neuromuscular junction, improving symptoms. Question 34. A patient with a history of multiple sclerosis presents with new-onset vision loss in one eye. Which diagnostic test is most appropriate? A. CT scan. B. MRI of the brain and spinal cord. C. Electromyography, EMG. D. Lumbar puncture. Answer: B. MRI of the brain and spinal cord. Rationale: MRI is the diagnostic test of choice for multiple sclerosis, as it can detect lesions in the brain and spinal cord associated with the disease. Question 35. A nurse is caring for a patient with Alzheimer's disease who is experiencing wandering behavior. Which intervention is most appropriate to ensure the patient's safety? A. Restraining the patient. B. Providing a secure, enclosed environment. C. Administering a sedative. D. Increasing the patient's physical activity. Answer: B. Providing a secure, enclosed environment. Rationale: a secure, enclosed environment allows the patient to move freely while preventing them from wandering into unsafe areas. Question 36. A patient with a history of stroke presents with dysphagia and difficulty communicating. Which intervention would be most helpful? A. Encouraging the patient to speak slowly. B. Providing written communication tools. C. Administering a sedative. D. Conducting frequent neurological assessments. Answer: B. Providing written communication tools. Rationale: written communication tools can help patients with dysphagia communicate more effectively when they have difficulty speaking. Question 37. A patient with a history of seizures is prescribed valproic acid. Which lab value should be monitored regularly? A. Serum sodium. B. Liver function tests. C. Serum calcium. D. Thyroid function tests. Answer: B. Liver function tests. Rationale: valproic acid can cause hepatotoxicity, so regular monitoring of liver function tests is essential. Question 38. A nurse is caring for a patient with Guillain-Barré syndrome who is experiencing ascending paralysis. Which intervention is a priority? A. Monitoring respiratory function. B. Administering corticosteroids. C. Providing physical therapy. D. Encouraging high-protein diet. Answer: A. Monitoring respiratory function. Rationale: ascending paralysis can affect the respiratory muscles, making monitoring respiratory function a priority to prevent respiratory failure. Question 39. A patient with multiple sclerosis is prescribed interferon beta 1A. Which side effect should the nurse include in the patient teaching? A. Increased risk of infection. B. Gastrointestinal bleeding. C. Bone marrow suppression. D. Flu-like symptoms. Answer: D. Flu-like symptoms. Rationale: interferon beta 1A can cause flu-like symptoms, including fever, chills, and muscle aches, especially after the first few doses. Question 40. A patient with Parkinson's disease is experiencing on-off phenomena with their medication regimen. Which adjustment is most likely needed? A. Increasing the dosage of carbidopa/levodopa. B. Adding an MAOB inhibitor. C. Reducing the dosage of carbidopa/levodopa. D. Switching to a dopamine agonist. Answer: B. Adding an MAOB inhibitor. Rationale: adding an MAOB inhibitor can help smooth out the on-off phenomena by prolonging the effects of carbidopa/levodopa. Question 41. A patient with a history of epilepsy is experiencing status epilepticus. Which medication should the nurse prepare to administer first? A. Phenytoin. B. Diazepam. C. Valproic acid. D. Levetiracetam. Answer: B. Diazepam. Rationale: diazepam is a benzodiazepine used as the first-line treatment for status epilepticus to quickly stop the seizure activity. Question 42. A patient with a recent diagnosis of Myasthenia gravis is experiencing muscle weakness. Which diagnostic test is used to monitor the disease progression? A. MRI of the brain. B. Electromyography, EMG. C. Tensilin test. D. CT scan. Answer: B. Electromyography, EMG. Rationale: EMG is used to monitor the progression of myasthenia gravis by assessing the electrical activity of muscles. Question 43. A nurse is providing discharge instructions to a patient with a history of migraine headaches. Which dietary modification should be recommended to prevent migraine triggers? A. Increasing caffeine intake. B. Avoiding aged cheeses and processed meats. C. Consuming more citrus fruits. D. Reducing protein intake. Answer: B. Avoiding aged cheeses and processed meats. Rationale: aged cheeses and processed meats contain tyramine, which can trigger migraine headaches. Question 44. A patient with multiple sclerosis is experiencing new-onset tremors. Which medication might the healthcare provider prescribe to manage this symptom? A. Propranolol. B. Baclofen. C. Carbamazepine. D. Donepezil. Answer: A. Propranolol. Rationale: propranolol is a beta blocker that can be used to manage tremors in patients with multiple sclerosis. Question 45. A patient with a history of Alzheimer's disease is admitted with acute confusion and agitation. Which lab value should be checked to rule out a common reversible cause of these symptoms? A. Serum calcium. B. Blood urea nitrogen, BUN. C. Serum glucose. D. Urinalysis. Answer: D. Urinalysis. Rationale: a urinary tract infection is a common reversible cause of acute confusion and agitation in elderly patients, including those with Alzheimer's disease. Question 46. A patient with Myasthenia gravis is undergoing plasmapheresis. Which potential complication should the nurse monitor for during the procedure? A. Hypertension. B. Hypokalemia. C. Hypocalcemia. D. Hyperglycemia. Answer: C. Hypocalcemia. Rationale: plasmapheresis can cause hypocalcemia due to the use of citrate as an anticoagulant, which binds calcium. Question 47. A patient with a history of epilepsy is being evaluated for surgical intervention. Which diagnostic test is most commonly used to localize the seizure focus? A. MRI of the brain. B. Electroencephalogram EEG. C. CT scan. D. Lumbar puncture. Answer: B. Electroencephalogram EEG. Rationale: EEG is used to monitor the electrical activity of the brain and localize the seizure focus for potential surgical intervention. Question 48. A patient with a history of stroke is experiencing spasticity in the affected limbs. Which medication might the healthcare provider prescribe to manage this symptom? A. Baclofen. B. Carbamazepine. C. Donepezil. D. Propranolol. Answer: A. Baclofen. Rationale: baclofen is a muscle relaxant used to manage spasticity in patients with neurological conditions such as stroke. Question 49. A patient with Parkinson's disease is prescribed Selegiline. Which instruction should the nurse include in the patient teaching? A. Take this medication at bedtime. B. Avoid foods high in tyramine. C. Increase your fluid intake. D. Avoid exposure to sunlight. Answer: B. Avoid foods high in tyramine. Rationale: Selegiline is an MAOB inhibitor, and patients should avoid foods high in tyramine to prevent hypertensive crises. Question 50. A patient with a history of multiple sclerosis presents with muscle spasticity. Which non-pharmacological intervention should the nurse suggest? A. Cold therapy. B. Stretching exercises. C. Increased protein intake. D. Bed rest. Answer: B. Stretching exercises. Rationale: stretching exercises can help reduce muscle spasticity and improve flexibility in patients with multiple sclerosis. Question 51. A patient with a recent diagnosis of myasthenia gravis is started on pyridostigmine. Which side effect should the nurse monitor for? A. Hypertension. B. Diarrhea. C. Bradycardia. D. Hyperglycemia. Answer: B. Diarrhea. Rationale: pyridostigmine can cause gastrointestinal side effects, including diarrhea, due to increased cholinergic activity. Question 52. A patient with a history of epilepsy is prescribed topiramate. Which side effect should the nurse include in the patient teaching? A. Weight gain. B. Increased appetite. C. Difficulty concentrating. D. Hair loss. Answer: C. Difficulty concentrating. Rationale: topiramate can cause cognitive side effects, including difficulty concentrating and memory problems. Question 53. A nurse is caring for a patient with Guillain-Barré syndrome who is receiving plasmapheresis. Which assessment finding would require immediate intervention? A. Flushing and itching. B. Fever and chills. C. Decreased urine output. D. Muscle weakness. Answer: C. Decreased urine output. Rationale: decreased urine output can indicate renal complications or hypovolemia, requiring immediate intervention. Question 54. A patient with a history of stroke is experiencing expressive aphasia. Which intervention would be most helpful? A. Providing a communication board. B. Encouraging the patient to speak louder. C. Administering a sedative. D. Offering written communication. Answer: A. Providing a communication board. Rationale: a communication board can help patients with expressive aphasia communicate effectively when they have difficulty speaking. Question 55. A patient with multiple sclerosis is prescribed baclofen. Which side effect should the nurse include in the patient teaching? A. Hypertension. B. Muscle pain. C. Drowsiness. D. Tachycardia. Answer: C. Drowsiness. Rationale: baclofen can cause central nervous system side effects, including drowsiness and dizziness. Question 56. A patient with a history of Alzheimer's disease is admitted with acute confusion. Which diagnostic test should be performed to rule out a potential cause? A. MRI of the brain. B. Chest X-ray. C. Blood glucose test. D. Electrocardiogram ECG. Answer: C. Blood glucose test. Rationale: hypoglycemia can cause acute confusion and should be ruled out as a potential cause. Question 57. A patient with a history of epilepsy is experiencing frequent seizures despite medication adherence. Which intervention should the nurse anticipate? A. Increasing the current medication dose. B. Adding a second anti-epileptic drug. C. Discontinuing the current medication. D. Switching to a ketogenic diet. Answer: B. Adding a second anti-epileptic drug. Rationale: adding a second anti-epileptic drug can help control seizures that are not well managed with a single medication. Question 58. A patient with a history of multiple sclerosis presents with urinary incontinence. Which intervention is most appropriate? A. Scheduled toileting. B. Use of a Foley catheter. C. Increased fluid intake. D. Administration of diuretics. Answer: A. Scheduled toileting. Rationale: scheduled toileting can help manage urinary incontinence by encouraging regular bladder emptying. Question 59. A patient with a history of Parkinson's disease is experiencing orthostatic hypotension. Which intervention should be included in the nursing care plan? A. Encouraging the patient to move quickly. B. Increasing salt intake. C. Administering a diuretic. D. Elevating the head of the bed. Answer: D. Elevating the head of the bed. Rationale: elevating the head of the bed can help manage orthostatic hypotension by promoting venous return. Question 60. A patient with a history of stroke is experiencing dysphagia. Which diagnostic test is most appropriate to evaluate this condition? A. CT scan. B. MRI of the brain. C. Barium swallow. D. Electromyography, EMG. Answer: C. Barium swallow. Rationale: a barium swallow is used to evaluate swallowing function and identify any abnormalities causing dysphagia. Question 61. A patient with a history of epilepsy is prescribed carbamazepine. Which side effect should the nurse include in the patient teaching? A. Weight loss. B. Hyponatremia. C. Hyperglycemia. D. Tachycardia. Answer: B. Hyponatremia. Rationale: carbamazepine can cause hyponatremia, so patients should be aware of this potential side effect. Question 62. A nurse is caring for a patient with Guillain-Barré syndrome who is experiencing autonomic dysfunction. Which assessment finding would be most concerning? A. Tachycardia. B. Flushing. C. Bradycardia. D. Diaphoresis. Answer: C. Bradycardia. Rationale: bradycardia can indicate severe autonomic dysfunction and requires immediate attention to prevent cardiac complications. Question 63. A patient with a history of multiple sclerosis presents with new-onset urinary retention. Which intervention is most appropriate? A. Continuous Foley catheter. B. Scheduled intermittent catheterization. C. Administration of diuretics. D. Increased fluid intake. Answer: B. Scheduled intermittent catheterization. Rationale: scheduled intermittent catheterization helps manage urinary retention and reduce the risk of infection compared to continuous catheterization. Question 64. A patient with a history of epilepsy is experiencing a generalized tonic-clonic seizure. Which immediate intervention should the nurse perform? A. Restrain the patient to prevent injury. B. Place a tongue blade in the patient's mouth. C. Administer oxygen via nasal cannula. D. Turn the patient to the side to maintain airway patency. Answer: D. Turn the patient to the side to maintain airway patency. Rationale: turning the patient to the side helps maintain airway patency and prevent aspiration during a seizure. Question 65. A patient with a recent diagnosis of Myasthenia gravis is experiencing difficulty swallowing. Which intervention is most appropriate? A. Providing thickened liquids. B. Encouraging large meals. C. Offering thin liquids. D. Administering an antiemetic. Answer: A. Providing thickened liquids. Rationale: thickened liquids are easier to swallow and reduce the risk of aspiration in patients with dysphagia due to Myasthenia gravis. Question 66. A patient with a history of Parkinson's disease is experiencing increased tremors. Which medication adjustment would the nurse anticipate from the healthcare provider? A. Increasing the dosage of carbidopa/levodopa. B. Adding a cholinesterase inhibitor. C. Initiating anti-epileptic drugs. D. Reducing the dosage of beta blocker. Answer: A. Increasing the dosage of carbidopa/levodopa. Rationale: increasing the dosage of carbidopa/levodopa can help manage worsening tremors in Parkinson's disease. Question 67. A patient with multiple sclerosis presents with new-onset spasticity in the lower extremities. Which medication might the healthcare provider prescribe to manage this symptom? A. Baclofen. B. Carbamazepine. C. Donepezil. D. Propranolol. Answer: A. Baclofen. Rationale: Baclofen is a muscle relaxant used to manage spasticity in patients with multiple sclerosis. Question 68. A patient with a history of epilepsy is experiencing frequent seizures despite medication adherence. Which diagnostic test should be performed to evaluate the effectiveness of the current treatment? A. MRI of the brain. B. Electroencephalogram EEG. C. CT scan. D. Lumbar puncture. Answer: B. Electroencephalogram EEG. Rationale: EEG is used to monitor the electrical activity of the brain and evaluate the effectiveness of the current anti-epileptic treatment. Question 69. A patient with a history of Alzheimer's disease is admitted with acute confusion and agitation. Which intervention is most appropriate to address the patient's symptoms? A. Administering a sedative. B. Providing a calm and quiet environment. C. Increasing physical activity. D. Restraining the patient. Answer: B. Providing a calm and quiet environment. Rationale: a calm and quiet environment can help reduce confusion and agitation in patients with Alzheimer's disease. Question 70. A patient with multiple sclerosis is experiencing new-onset urinary retention. Which diagnostic test is most appropriate to evaluate this condition? A. CT scan. B. MRI of the brain and spinal cord. C. Barium swallow. D. Urodynamic studies. Answer: D. Urodynamic studies. Rationale: urodynamic studies are used to evaluate urinary function and identify the cause of urinary retention in patients with multiple sclerosis. Question 71. A patient with a history of epilepsy is prescribed lamotrigine. Which side effect should the nurse include in the patient teaching? A. Weight gain. B. Hyperglycemia. C. Rash. D. Hypertension. Answer: C. Rash. Rationale: lamotrigine can cause a serious skin rash, including Stevens-Johnson syndrome, so patients should be aware of this potential side effect. Question 72. A nurse is caring for a patient with Guillain-Barré syndrome who is experiencing respiratory muscle weakness. Which intervention is a priority? A. Administering corticosteroids. B. Providing mechanical ventilation. C. Encouraging deep breathing exercises. D. Administering IV immunoglobulin. Answer: B. Providing mechanical ventilation. Rationale: respiratory muscle weakness can lead to respiratory failure, making mechanical ventilation a priority intervention. Question 73. A patient with a history of multiple sclerosis presents with new-onset vision loss in one eye. Which medication might the healthcare provider prescribe to manage this symptom? A. Prednisone. B. Baclofen. C. Carbamazepine. D. Donepezil. Answer A. Prednisone. Rationale: prednisone, a corticosteroid, is used to reduce inflammation and manage acute exacerbations of multiple sclerosis, including vision loss. Question 74. A patient with a history of epilepsy is experiencing frequent seizures despite medication adherence. Which surgical intervention might be considered? A. Thymectomy. B. Vagus nerve stimulation. C. Deep brain stimulation. D. Spinal cord stimulation. Answer B. Vagus nerve stimulation. Rationale: vagus nerve stimulation is a surgical intervention used to reduce the frequency of seizures in patients with epilepsy who are not well controlled with medication. Question 75. A patient with a recent diagnosis of myasthenia gravis is experiencing ptosis and muscle weakness. Which intervention should be included in the nursing care plan? A. Administering pyridostigmine as prescribed. B. Encouraging frequent rest periods. C. Providing thickened liquids. D. Scheduling physical therapy. Answer A. Administering pyridostigmine as prescribed. Rationale: pyridostigmine is an acetylcholinesterase inhibitor used to improve neuromuscular transmission and increase muscle strength in myasthenia gravis.